So the purpose of this information is to inform staff of the current standards for care in long-term care homes set out by the ministry, as well as the new long-term care policies for the health region which reflect upon these standards. The objectives are hopefully by the end, staff will be able to state what the program guidelines for special care homes are and why they're important, identify where the policies and procedures for long-term care found in your home, and recall what they have to do to become acquainted with the policies. So the program guidelines for special care homes initially came out in 1986 and they were recently updated in 2013. And if you see in the picture in this slide, that is what the cover should kind of look like if there is a manual in your home. I think most homes do have a copy of this around somewhere. It might be in your manager's office or out in the open where you can access it. You can also get it on the internet just by typing in program guidelines for special care homes. And so the purpose of this is that the ministry hopes that all homes in Saskatchewan long-term care should operate in accordance with the standards and the guidelines. They are minimum standards, and the Regional Health Authority, or for us Prince Albert Parkland, are responsible for ensuring that the guidelines are met. So a little bit of background about all of this, but what is an ombudsman? So in Saskatchewan, an ombudsman takes complaints about any kind of unfairness in government service. So it could be Ministry of Health, Ministry of Social Services, SaskPower, Sask Energy, anything like that. And they will look into the complaint and let the government know whether they are being fair or not about the issue. And they also work to make the general public aware of their services. And if you see a little cartoon here, it's saying, "Mom, Dad, this is Kevin, our new ombudsman." And I'm sure a few of you hope that they could have one in their home one day. So the Ombudsman's report, this is coming from CTV News, and it's just a clip about an Ombudsman's report that came out from a long-term care home about a lady called Margaret Warholm. And we'll just play it now.
Prior to the death of 74-year-old Margaret Warholm.
Margaret was in pain, her eating was limited, her skin was worsening.
The Regina woman spent 2 years at Regina's Santa Maria nursing home. The ombudsman found that her bed sores were not properly treated, her condition not accurately recorded, her care plan was not updated, pain was not effectively managed, and the nutritional standards were not met, as the woman slowly starved to death. She died in hospital in October of 2013. The ombudsman heard from 89 other families, province-wide, during the course of the investigation, and made 10 recommendations for system improvements.
The government has to get a hold of what they need to do with their long-term care system. It's systemic in the fact that we have seen the same type of complaints from all over the province.
The government has pledged cooperation.
I accept the report on behalf of the government of Saskatchewan. We look forward to continuing to work with the Ombudsman as we implement the recommendations.
The Ombudsman recommended better reporting, better communication, and better adherence to standards. The nursing home says it's already being implemented.
And Mrs. Warholm is a terrible example of care that fell down. We must move forward and learn from those so that others don't have that occur to them.
The NDP believe expectations need to be laid out more clearly.
And the Ombudsman clearly identifies this as a gap. You know, we've got these guidelines out there, but care facilities don't know what they mean, don't know what there's no accountability mechanism, no follow-up.
The family feels the report confirms its concerns.
It doesn't bring her back, but we're just happy that other people, it helped other people, and Mom gave us the strength to do that.
The Ombudsman isn't finished with this issue. She says there are a number of other cases that she plans to investigate, and she'll be back in 6 months to check on what the government and the Santa Maria Nursing Home have done to implement her recommendations. Wayne Mantika, CTV News, Regina.
So, for those who've maybe had a chance to read the report, it's about 48 pages long, and it's very interesting to read some of the things that happened to this lady. And most things that have happened seem somewhat preventable in a way. Her bed sores continually worsened, nutrition, her weight continually she lost weight continually, um, and her pain as well didn't seem to be managed very well. And when they look back at the chart and her care plan, it didn't really seem like it was anything was really documented to improve these issues, and the care plan in her room never seemed to get updated. And I think the family complained to the staff and maybe the manager at times, but never anything didn't seem to get done to help improve her care. And so I think that's why this case has gone so far. And the ministry probably looks at it like, especially it's out in the public now, so they have to do something about it. And the ombudsman said that she did get complaints from all over Saskatchewan. So continuing forward, the ministry, like you saw in the video, Dustin Duncan mentioned that they were going to put out 4 recommendations, and so to ensure the health regions develop policies and procedures and a way to operationalize the standards of care in the program guidelines for special care homes and identify specific measurable indicators or outcomes that will be tracked and reported. Implement a process to publicly report on how long-term care facilities are meeting the standards in the program guidelines. Set out detailed steps for handling of concerns in the appeal process within the program guidelines. And so for that, it's because the family had complained and let their concerns be known, but nothing really happened. So now we need to know what to do when a family is complaining about the care that their loved one is receiving. As well, develop and implement a long-term care strategy to meet the needs of long-term care residents and address factors affecting the quality of long-term care in Saskatchewan. And so this is just a little bit of a breakdown of it. So the ministry is setting the standards and the program guidelines for special care homes. And they're also creating an audit tool or audit tools so they can look at specific things that each home in Saskatchewan is doing. The health regions make the policies to ensure the standards are being met and also monitor the quality indicators for every home. And ensuring the standards are met through the education audits and the results from the audits. Facilities follow the standards and policies set out to ensure they are being met, and staff need to become aware of the standards and policies to ensure safe, competent care for each individual. And this can be done by knowledge of the guidelines and the policies and procedures, and as well providing care that reflects policy. And throughout everything that comes from the ministry, I think the biggest thing they want to highlight is resident-centered care. So the care that we're providing should be reflecting what the resident wants or resident needs. So purposeful hourly interactions is also something that stemmed from the Ombudsman's report and Margaret Warholm. And so the ministry initiated to ensure care needs were being met. It's not just about looking at the resident every hour, it's looking at the whole picture. So for Margaret, okay, her bed sores are getting worse. What can we do to make this better? Her weight is, maybe she needed to be repositioned more frequently. Her weight is decreasing. Could we offer her a sip of Ensure every hour maybe, or try feeding her at different times of the day if we're in there every hour? Just little things to try and improve everyone's care, not specifically always thinking of the 5 Ps, not specifically asking the question of the 5 Ps, but looking at what that resident needs at that time, and maybe it's something they ask for, or maybe it's something that would improve their care. A sip of water, or maybe it's just sitting and talking with them for a few minutes. And it's a little bit more about a change in culture, so going from task orientated to resident focused. So some of the things that have been noted from purposeful hourly interactions is a decrease in falls. Some residents actually are quite liking the fact that staff are coming around every hour to check on them, because it gives them reassurance and they know someone's coming back. And as well, maybe a little bit better behaviors, and residents who are communicating a little bit more because people are interacting with them a little bit more. So out of all of this is maybe the most Eden focus we can take out of everything. So really trying to connect with our residents and create relationships and make them laugh, smile, those kinds of things if possible. So the goal, standardized care and long-term care, hopefully better resident outcomes, improved safety, and happier residents, families, and staff. So I did talk about audits a little bit, and so the ministry's made audit tools so each home can look at specific areas, so the residents' charts, employee files, and the home itself, and look at specific criteria to see whether they are doing what they're asked in some places. And this is reflecting from the standards. So an example would be, so this is the first audit, resident charts. So first, one example would be for residents receiving nutritional supplements, documentation that products were consumed in accordance with the dietitian's orders. And so making sure that the dietitian or physician or nurse practitioner has actually ordered the supplement that the resident is on, so Ensure, Glucerna, and that you're actually documenting not just that they were consumed or not, but actually how much they're consuming. And as well, these are all the other things. Residents who are refusing care, what to do if they are refusing care. And so in our new policies, there's actually a shared risk agreement that we can use, so that the resident, their responsible person, are aware of the risks of refusing the care, and so that everyone's on the same page, and they actually can sign it so that it's documented. A medication review has been completed on a quarterly basis, so looking through the chart to see that that's done. So medication review should be done every 3 months, or if there's a change in status. So that's an example of audit, and I think the first audit is due now June 20th of 2016. So policies and procedures. So long-term care now has policies and procedures in place to cover each of the standards set out by the ministry, and the policies can be found on N-Drive, and as well as the intranet. And there is a printed copy at each home, and it looks a little bit like the picture in the bottom corner, except black and white. And right now this only has the initial policies that kind of need to be known. So instead of bringing this big book of policies, there's just a few in there at the moment. So how to find policies and procedures. So this is how to find policies and procedures on N-Drive. So you need to log into the computer, and on the bottom left hand corner you'll see a start button, and if you look 2 little icons over, there's some file folders, so you'll need to double click on that. Double click on N-Drive, shared, policies and procedures, long-term care, and you'll find all the policies and procedures there. When you go on the intranet, so if you click on the little E symbol when you log in right next to the start button, so double click on that, and that should bring you up to the intranet. And from there you'll go to policies and procedures, and when you put your mouse over top of that, another drop down menu will come up, and you'll double click long-term care, and all the policies and procedures should be there. They're just labeled under the name at this point in alphabetical order. On the internet, in EnDrive, they're numbered, so you'll see numbered sections in the manual as well. So implementation timeline, this is nothing anyone really needs to remember, but just so you know that there's going to be sections coming out every month, so that it's not overwhelming for staff that there's all this new stuff. And a lot of the policies aren't really new, but some of them have new things in them that need to be starting being used, and as well getting some education on them. And so the first sections in the manuals right now are 1, 2, 13, 15, and 17. And I'll go through what's in those sections a little bit more. So section 1 is the introduction about all of it, the purpose, philosophy, and objectives of what a special care home or long-term care looks like, and as well the standards of care. So it talks about nutrition, making sure we're taking care of the residents' belongings, making sure the residents able to get adequate rest, everything that kind of surrounds a specific person's needs at one time, anywhere. And of course, every resident's needs are going to be a little bit different. Section 2 talks about rights and responsibilities, so rights of the resident and rights of the special care home. And these are things that the resident should be aware of when they move into their home, their long-term care home, and provided to the family as well. And so in our policies there is a chart document that talks about the rights and responsibilities of the resident. And resident abuse talks about what to do if the resident is being abused, and also the resident's right to appeal the care that they're receiving. Section 13 talks about food and nutrition. So what to do if a resident is having trouble swallowing, what the dining experience should look like in a home. And so a good example of that is even what it smells like, what it looks like, room for everyone to eat. Food safety, so having safe food handling, nutritional assessments done by dietitians, the ability to have meal and snack service for residents, staff education, therapeutic nutritional products, talks about supplementation, so for those who maybe aren't eating very well. And these are the people that we want to be connecting with: the physicians, nurse practitioners, dietitian. They all should be on board. And tube feeding just talks about ensuring that we're following the dietitian's orders for tube feeds. Section 15 talks about resident care, so death of a resident, what to do when they pass, and how to deal with it. I don't think this policy has changed a whole lot, but it's good to know what to do when this happens. Falls prevention talks about the falls prevention program that currently is being used everywhere in our region. IV therapy right now is just talking about hypodermoclysis. So if a resident is having trouble not taking in enough fluid orally, we can give them fluid under the skin to help hydrate them. resident refusal of care is talking about how to deal with a resident who might not be wanting certain aspects of their care that we're trying to provide. And so this is where that shared risk agreement is coming in, and we can sit down with the family and talk about what the resident is refusing and the risks of it, and basically letting everyone know on the same page, and also maybe trying to find a reason why they're refusing, and if we can try and change things so they're not refusing anymore. Resident care plans, talking about them having to be updated and also meeting the MDS and CAPS care plan. Resident-centered care, so making sure the resident is always our primary focus and including their family or responsible person in their care. Resuscitative services talks about the managing life-threatening behaviors or advanced directives, goals of care. So what the resident would like to do if they were to get really sick, or if they were to get very sick and are near passing, if they were wanting CPR and those kinds of things. Resident Day Pass just talks about what we would do, mainly about documentation if the resident goes on a day pass. Managing behaviors actually has a new tool in it to use for behavior mapping. It comes from Alberta Health Services, and it's a 4-page, 4-step behavior mapping where you're mapping before, just to try and figure out when the behavior is happening, trying to cue in on it a little bit more, changing the medication, and seeing if changing the medication is actually beneficial to changing the behavior. Restraints talks about the least restraint policy, so using the least, no restraints if possible, and that being medication or any kind of physical restraint. And medication management talks about multidisciplinary medication reviews, and I think there will be more information added to this policy, but at this time it's talking about the quarterly med reviews and having a multidisciplinary team looking at the medications for each resident. And Section 17 talks about incidents and concerns, so incident reviews, investigation, and reporting. So unusual incident reports, how to report, quality improvement, basically refers back to a regional policy, and how to report to quality management if there is an issue. And we can, if someone comes in with a complaint, we should be documenting, letting our nurse in charge know, and if the family's still unhappy, then we can direct them to quality to look into the incident a little bit more, the concern. So that's about all I have for today. There are some ministry videos that have been put out to help with education, and they're quite good, but I'm not going to include them today because every home may have started them at this point. But if you have any questions or concerns, you can let me know. My contact information is here, and a few references for today. So thanks for listening and have a good day.